Nicotine, of course, is the addictive substance found in tobacco, which is the leading cause of preventable deaths in the United States. Secondhand smoke does contribute to the development of cardiovascular disease and lung cancer in non-smokers. Nicotine has both stimulant and sedative effects on the central nervous system. It stimulates the central nervous system to release epinephrine, and in turn, this epinephrine turns into glucose, and then the body goes through a period of recovery, which is the depressant effectiveness, and the patient experiences fatigue. Nicotine accumulates in the body and can last for up to 24 hours. Addictive properties are compared with that of cocaine receptor sites in the brain. So nicotine is very addictive. Withdrawal at about 24 hours, the patient can experience aggression, hostility, anger, and inappropriate social interactions. Educate your patient on these effects. Any patient trying to refrain from nicotine use, please do exhibit sensitivity because this is a real addiction. Give your patient options for community-based support groups or programs such as hypnosis or acupressure. Coping strategies to deal with the weight gain that might occur with stopping the nicotine and smoking. Nicotine patches or nicotine gum is available to aid in cravings. Medications such as Wellbutrin has been successful in helping individuals to stop smoking. Opiate blockers such as naltrexone with a nicotine patch has also demonstrated to be effective. A stimulant is anything that excites or increases the body's metabolism and activity. Some examples are caffeine or nicotine. Those are over the counter, but your prescribed substances are such as amphetamines, methamphetamines, illegal substances such as crack, which is a potent form of cocaine. The stimulation of general metabolism is achieved through increasing the respiratory and cardiac function. In 2006, 1.9 million Americans ages 12 and older had abused methamphetamine at least once in the year prior to being surveyed. Recreational use of amphetamines creates euphoria and grandiosity. Methamphetamine is closely related to amphetamine but has a longer lasting and more toxic effect on the central nervous system. It causes high levels of dopamine to be released, which damages the cells in the brain that contain serotonin. We can also observe symptoms that look like Parkinsonism found in our long-term stimulant users. Recreational use of methamphetamines causes rush or flashes, life-threatening myocardial infarction and liver damage, hyperthermia, and acute renal failure. Irreversible damage can be done to the vessels in the brain, which can cause stroke. Cardiovascular collapse is often the cause of death from stimulant users. Long-term effects can also include paranoia, memory loss, delusions, severe dental problems. This is due in part to a decrease in saliva production. Your patients will also crave sweet beverages, and this in combination with poor mouth hygiene and the acid content of the meth, patients usually grind their teeth as well. And what is the end result is someone that has what we call meth mouth, very poor dentition, very poor oral hygiene, rotting teeth and gums. Methamphetamine also causes harmful effects to those exposed without the ingestion of it. It is an environmental hazard. The environment around these illegal meth labs is toxic. This toxicity comes from over-the-counter pseudoephedrine, such things as drain cleaner, fertilizer, starter fluids. These are various different things that are mixed in with the methamphetamine. It requires decontamination of this environment as well as of the people living in the environment. Again, the Combat Methamphetamine Epidemic Act of 2005 did require that pseudoephedrine containing products be kept behind counters in retail inside pharmacies for an attempt to decrease this use. Without medical intervention, if prolonged, the client could suffer brain damage, fall into a coma, or be fatal. Priority for both overdose and withdrawal is safety, both physical and psychological. With overdose, your nursing care is vital signs frequently, checking for hyperthermia, also checking for hypertension and respiratory distress. It might require respiratory support. If the patient is hyperthermic, it requires cooling blankets. If the patient is experiencing convulsions, then an anticonvulsant medication would be required. The high acid content requires ammonium chloride to acidify urine for excretion of the amphetamine. With withdrawal, your nursing care is still going to be to monitor the vital signs very closely, in addition to administering anti-anxiety medications, possibly antidepressants. Dopamine agonists are going to help reduce the tremors that the patient may be experiencing. Now, for specific nursing care of a patient either overdosed or in withdrawal from cocaine, it is critical to monitor this patient's cardiac function closely, frequent vital signs, assess them for depression and or suicidal ideations, especially during the withdrawal phase. Pay careful attention to the mucous membranes of the nasal passages. Cocaine use is going to deteriorate the membranes as well as the nasal septum. Nosebleeds are going to be expected with snorting of cocaine. This will also help aid you in assessing the amount used or the time of use. Cardiopulmonary arrest can occur with the first use. So if your patient presents with cardiopulmonary arrest from cocaine, this cannot be indicative of the extent of usage. It may be the first time, or it may be from a very prolonged period of time. General medical care is going to be the same as with any other stimulant use. Hallucinogens. These are mind-altering or mental perception-altering properties. They can cause the thrill effect. LSD and PCP, these are dissociative drugs. MDMA, this is an altered amphetamine and marijuana drug. In 2006, 25 million Americans ages 12 and older had abused marijuana. It does alter the mood and causes sensory alterations. It can cause delusions or a feeling of an out-of-body experience. Vital signs will be elevated. The patient will experience and present with dilated pupils. Physical dependence, suicidal and psychotic episodes occur with the use of hallucinogens. When a patient uses a psychedelic drug, it can also cause a flashback to occur in this patient. And this flashback can happen at any time. It may be years after use of the drug. A flashback takes the user back to the initial drug use or feeling or experience. It also is exhibited in paranoia and suspicious behaviors. LSD interrupts nerve action and neurotransmitters of serotonin. Serotonin regulates behavior and perception. It also helps to regulate body systems such as hunger, mood, and temperature. The effects can last up to 12 hours and can result in a feeling of pleasure, or it can result in a feeling of disturbing experience. Hallucinogens are marketed to adolescents and children. The hazards of the use are affected by the dosage, the personality, or the mood of the user. The treatment for LSD would be crisis or safety. Your patient's probably going to need to be on a one-to-one observation to keep them from acting on psychotic thoughts. Continual reality orientation will need to be done until the patient is able to distinguish reality and the side effects of the hallucinogens begin to wear off. A low stimuli environment is needed. Anti-anxiety medications such as benzodiazepines may also need antipsychotic medications such as Haldol. And then PCP, it does cause distortions of perceptions. If the symptoms of toxicity are observed, you'll see an increased heart rate, blood pressure, nausea and vomiting, psychomotor retardation, memory loss. PCP acts in the body by altering glutamate throughout the brain, which controls pain, perception, environmental response, and memory. A drug of use that is sometimes termed the businessman's LSD is ketamine. Ketamine can cause euphoria, a loss of inhibitions, confusion, ringing in the ears, a quick burst of energy, or a drunken feeling. A ketamine overdose is going to include tunnel vision, shortness of breath, loss of balance, numbness in the body, clinical depression, a loss of time, possibly seizures and or coma. The nursing care is to decrease the environmental stimuli. The drug does have respiratory concerns for respiratory depression because of the anesthetic properties of the drug. MDMA, as I mentioned earlier, this is like ecstasy, also marijuana, and we're going to discuss spice in the next few slides.